Hello, I'm Dr. Jayachandra, working as a senior pulmonologist in Care Hospitals, Banjara Hills. I've been asked, what precautions do you take to prevent an individual from getting tuberculosis? What it essentially means is, how do you avoid exposure to tuberculosis? Some cases, exposure is unknown, inevitable. That is, a person at home, an elderly person at home, develops tuberculosis. He's coughing, which he has been doing for a long time. You don't bother. He's not running much temperature, so you're not really worried about it. He's going on like everything is quite normal. But what happens is, if that person at home, whether it is an elderly member of the family, whether it's a maid who's working part-time, whether there's a visitor who comes in quite frequently, anybody who has a cough, you're not aware that they have a disease, they could be spreading it around, especially when they are coughing. So make sure that people who are in close contact with the family, particularly the family members or frequent visitors to the house, you make sure that they don't have any disease. Maids and other people, if you think they are likely to be having it, get them screened. It is worth all the money that you spend to screen these people. Second thing is, if somebody has been diagnosed with tuberculosis, it makes sense to get everybody in the family screened for this particular disease. Second thing, this comes out of experience working as a doctor in hospitals. There's one individual who is admitted for whatever may be the reason. You find 10, 15 people trying to visit him. Whatever for, I could never figure it out. Courtesy is one thing, but the thing is, so many people visiting a hospital for no valid reason are exposing themselves to the risk of infection. Maybe tuberculosis, maybe XYZ, it doesn't matter, but they're all getting exposed to diseases. So when somebody is sick in the hospital, send them your good wishes by post, by telephone, by WhatsApp, what have you. Avoid going to hospitals as much as you can. Children should never be brought to the hospital as visitors. That is an extremely important thing. And once you know that somebody has got tuberculosis, make sure that the patient himself is masked all the time, or you wear a mask whenever you go there. If he is getting treated, after about, say, a week or 2 weeks of appropriate treatment, he usually loses that capacity to spread it to other people. So they are reasonably safe. The unsafe exposure comes in when there's an undiagnosed case in the family or in your environment. So that is where you need to be guarded against. So be careful. These days everybody seems to be wearing a mask, but I see that most of them have discarded the mask, especially going out to the market and all that. Somehow I think it makes a lot of sense for you to wear it in public places, especially with a very high incidence of tuberculosis in our country. Wear a mask. It doesn't hurt you. It is going to help you all the time. Thank you.